The highlights of today's important topic of the conference is the important uses of beta-adrenergic blocking drugs. Well, the most important ones, they are related to the system of the heart, the eye, and many more. Welcome all to his Pharmacology Difficult podcast. I'm your host, Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find, and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. So to begin with, the most celebrated and essential use of beta blocker drugs in the present era is in the therapy and the treatment of hypertension, congestive heart failure, infarction states, and acute coronary syndromes. Yes, they all are heart-related pathologies. Beta blockers also find significant use in the therapy of supraventricular and ventricular arrhythmias. They are very useful in hypertrophic obstructive cardiomyopathy. What do you think? The main key point used is in the relief of the pressure gradient along the outflow tract in the heart. The cardiomyopathy in the pathology of pheochromocytoma is also suppressed with the use of beta-adrenergic antagonists. Yes, that is a result of excessive catecholamines. Beta blocker agents, they also significantly cause decline in the production of worsening cardiac contractile force, and by doing that, they show significant use in the pathology of dissecting aortic aneurysm. In the situations of dissecting aortic aneurysm, most of the times the main drug therapy is the use of sodium nitroprusside, and beta blockers, they are a kind of an add-on drugs. They also curb the reflex tachycardia, which can be caused if nitroprusside is used all by itself, that is all alone, as a monotherapy. So reflex tachycardia can be a serious side effect with nitroprusside therapy, and that could pose real problems to the suffering subject of dissecting aortic aneurysm. What else and where else can beta blockers help out? Aortic dilatation associated problems, they are also curbed down significantly in the pathology of Marfan syndrome. And when these patients, they are put on a chronic beta blocker therapy, then they are highly benefited because their aortic dilatation problem is actually resolved. Now, these were the important cardiac pathologies that were benefited with the use of beta blockers. Let's talk about the situations or the conditions of the eye, that is ophthalmic states. In that, I have very importantly to talk about the chronic open angle glaucoma. Yes, that is an important indication of the beta blocker therapy. The subjects, they are benefited by the significant decline in the aqueous humor production. Now next we're going to talk about the miscellaneous uses, that is versatile uses of beta blockers. Whenever you open a book, you find a long list of the indications of the beta blockers. So amongst the versatile uses, the first one I want to talk about is the hyperthyroidism. In hyperthyroid subjects, there is a raised sympathetic tone that leads to cardiovascular complications. This raised sympathetic tone is perfectly effectively attenuated with the use of the beta antagonistic agents. Second important use of especially propranolol, that is a non-selective beta blocker agent, it has an independent effect in hyperthyroid patients by blocking the peripheral conversion of thyroxine to triiodothyronine. And that is how it curbs down the negative manifestations seen in hyperthyroid subjects. Next important use is of the propranolol, metoprolol and timolol. These are very effectively used in the prophylaxis of migraine. Mind it, not in the therapy of migraine, only in the prophylactic states. Next important use is of propranolol in the treatment of performance anxiety. The unwanted side effects like tremors, tachycardia, they are all curbed down and finally attenuated by the use of propranolol. Next important use of beta blockers lies in the subjects which are undergoing alcohol withdrawal and also facing problems of akathisia, Raynaud syndrome, that is variceal bleeding. They all are benefited with the use of the beta blocker therapy. Drugs like propranolol, nadolol, they are very useful in curbing down the variceal bleeding. Now, here you need to understand the cause of the variceal bleeding. It's generally a result of the portal hypertension that leads to the cirrhosis of liver. Now, that was the general therapeutic profile of the beta blockers. At present moment, it would be very highly sensible and desirable to talk about the individual drugs, and that too we should begin the talk with a prototype non-selective agent like propranolol. Propranolol actually is equally effective on both beta 1 and beta 2 receptors. Now you should know some few facts, that is, propranolol possesses no intrinsic sympathomimetic activity and it has a little lower beta 2 receptor affinity. Now there are very high levels of variations in the first pass metabolism of the propranolol which are actually observed amongst the different individuals, and that is responsible, that actually accounts for the greater level of the differences and variability in the individual people responses and the plasma levels of the same dose of propranolol that is administered. Another fact you need to know is that food enhances the bioavailability of propranolol. Next important point is the propranolol, it easily enters the central nervous system. It is highly plasma protein bound. And one of the important metabolites is 4-hydroxypropranolol, which actually may possess a good level of beta adrenergic blocking effect. As far as the more pharmacokinetic profile of propranolol is concerned, the drug is stereospecific, especially in regard to distribution and clearance. You need to understand here that clearance is basically a product of the interplay of the hepatic parameters like blood flow, hepatic pathologies, and the use of other different drugs concomitantly along with propranolol. All these combinedly affect the clearance of propranolol. Other important facts are that plasma half-life, that is T-half of propranolol is quite short. So twice daily dosing is actually required and it's much in vogue. There are sustained release formulations which are very commonly used. And another important point is that intravenous administration is very importantly life-saving route of drug administration in the states of acute arrhythmias. that too in anesthetized subjects. While treating acute arrhythmias in anesthetized patients, proper monitoring of the drug is very important. So these were some important facts and important highlight points associated with the therapeutic uses of beta blockers, especially today we talked about propranolol. Next time I'm gonna arrive with another factful, informative bunch of the uses of different beta blocker agents other than propranolol. Till then, Abientot, Aurevoir. For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, is Pharmacology Difficult. If you're listening for the first time, do subscribe and follow whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you.